see?
All right. Wonderful. Wonderful. All right. Let's dive in. Y'all. So, um, one thing we're gonna start off with is coming upon this joint commission survey. Everybody has to have a name tag. So if you don't have a name tag, please get with Miss Casey. She'll print you a new one, but you need to have a name tag on. Also, if you have a lanyard, it has to be a breakaway lanyard because you can get choked. So make sure that we have that on. When folks get here, that's the first thing they're gonna ask. They wanna see your name badge, they wanna see your lanyard, all that good stuff. But make sure we have that. Next thing, walkie-talkies. Does everybody have a working walkie-talkie? If you don't have a working walkie-talkie, get with me, get with Jess Andre, so we can get you fixed up. The channel for the walkie-talkie, this is a joint commission question. What channel are you on? Anybody know? 10, we on 10-2. 10-2, don't forget that. We're on 10-2. If you're in a session, a private session with a patient, please don't turn your walkie-talkie off. Turn it down, but keep it on. I want you all to be totally honest now. Let's see if you want to tell the truth. Because I was outside watching. Yesterday, we had a code black. How many of y'all, I want you all to be totally honest. How many of you all heard it on the walkie-talkie the first time? The first time. How many of you all heard it through the PA system? Cool. Y'all heard both. All right, great. So make sure that we have those walkie-talkies on. If we have a cold silver, which is an active shooter, you don't have your walkie-talkie on. Be a little tight on it. Be tight. So make sure you have your walkie-talkie on. I passed out some fire evacuation drill sheets out the other day. Code red, if we hear code red to building 5, what should we do first? Go to building 5 first. With an extinguisher. Where are the extinguishers? Exits at every door. Go to the fire with an extinguisher, and then you go to your houses and check, get your patients out. Our common area is the basketball court. We stay on the basketball court. The roll call is done. Fire department comes, police department. Until we give the all clear. Leadership, myself, Jesse, or the fire department is going to give an all clear. If you don't have an all clear, we don't go back to our houses. We gotta make sure that some of our patients, if they're using the restroom, we gotta get them out. We gotta get them out. On yesterday, folks had some questions. What if we have a bomb threat or active shooter and I get the patient and they don't wanna move? If it's a bomb threat, we would try our best to get the patients out. If it's an active shooter, being honest with yourself, you're gonna probably grab you a couple patients and you're gonna go hide when you find out that's active shooter. But we want to make sure we grab our patients because they don't know. We can have a drill every day. They won't remember that. So make sure anytime we have a drill that you try to get the patients away. If that patient is the core red, they're using the restroom, get them out of the restroom. Dietary, make sure that you're turning your oven off. Make sure that you're turning your steam table off. Make sure you're turning your water off. For my nurses in the THH, make sure that we have no patients in the THH. We have these small little areas that we gotta make sure we contain and get everybody out. Anybody got questions about code red? Change your mind?
Well, it was about cold black.
Oh, we're gonna get to that. All right, so code white, combative situations. Who responds to code whites? Everybody. I can tell y'all this, one of the comments made by the patients was, I like the way all the staff show up when they have something going on. I don't know if you all pay attention to this, but sometimes just the force, seeing people, it kind of settle things down when we have a code white. One thing we want to make sure of is a code white. For example, if Mr. Andre is engaging with a patient, he has a good rapport with him, they're settling down. Just because you have a rapport with that patient, don't go interrupt the intervention. If Mr. Andre say, I'm good, I'm cool, we stay there and make sure that he's safe, but don't try to jump in because you may mess up the intervention. That makes sense? And Creatures of habit, sometimes that can happen, but if another staff member asking you to back off, they got it, like, respect that. Still be around, but don't interrupt the intervention. Code Blue, this is one we've been having quite a bit of. Code Blue, who responds to that? Everybody. All right. So what happens when we get to the Code Blue? The patient's having a seizure. I'm gonna use that because it's been common. What should we do next as staff? Follow the nurse's instructions. So once the nurses get there, we need to back up and give them some space so they can do their job. The nurses are going to direct us on what to do. So you all, if we have a code, y'all probably hear one of the leadership team members, we might ask one of the nurses, we call 911, we send them out, like, what we doing? We just waiting on the nurses to tell us what to do. One of the struggles we have, the patients don't want to move. They just want to be so helpful. As staff, our job is to de-escalate and get everybody away as soon as possible. I spoke to Andre and Darielle about this and Jesse last week. When the code is called, once things seem to be contained, we want staff to kind of go back to doing their job. The code is not clear. That medical code may not be clear, but we need folks to go back and do their job. If the nurses want us to stay, I need a wheelchair, they'll let us know what they need. But a lot of times we have a patient here now that's experiencing some issues, but it's also some attention-seeking issues too. So we want to make sure that we're not giving them more than they need. Any questions about Blue? All right. I want to go back to Blue. If a patient is bleeding, what should we do? PPE. PPE. Who said that? Not you. I want somebody else to say it. PPE. Make sure that you have on your proper equipment to deal with a crisis. For example, we try not to go to a Code Blue without having gloves because we don't know. If someone is bleeding, you want to make sure that you're protected. You want to make sure you have hand protection, eye protection, and also an apron or a shield. We have all that in the nursing station. I know that when the code is called, we already high level, but we got to reduce the risk by what? Protecting ourselves. Go home the same way you came. Y'all hear me say that a lot in CPI. Get some gloves. If a patient is slinging blood, there's blood-borne pathogens going everywhere. You need to have some gloves on. We don't have that happen here often, but y'all, at this facility, it can happen at any time. So make sure that we're protecting ourselves. Green chart. Who's responsible for green chart? Leadership team. All right. So if you call a green chart, we need you all to tell us what we need to do. For example, if we walk in and open the door, we need you to say, I'm good, I'll come in, like direct us, because we don't want to be too much. Is it appropriate to call a code white if we're not there? Absolutely, yes. If there's any doubt, because coming from administration to the therapy center could be a long run. But if we're not there, it's okay to call a code. It's easier for us to get folks away if we have too many. We hadn't had many green charts lately, and that's because of you all. We want to thank you all for helping us to de-escalate some of those smaller situations. Well, we don't need it, but we have it. It's available to you. Code gray. We actually may go into a code gray. That's a tornado. I'm not sure. We're gonna meet today to discuss the weather. I know some of y'all wonder what we're doing. I got calls, what we doing with the weather? We hadn't even talked about it yet. So we'll fill you all in. And while we're talking about that, if you have a new phone number, if you have a new number, please get with Miss Casey or Miss Megan today before you leave. Why is that important? We have a disaster planning plan. If we change programming, or maybe a road may be down that we can divert you somewhere else, we want to be able to call you. Please answer the phone. Please answer the phone. Please answer the phone. Please answer your text messages. You're welcome. Another reason why we should have our IDs. So we are considered essential staff. So if something happens and you need to get the police to stop people from coming, if you show them your name, your badge, they're gonna let you through. The folks are counting on you to be here, we're counting on you to be here. So during a tornado, code break, we get everybody out of the trailers and put them in house 1, house 2, house 3, house 12, the therapy center. We wanna make sure that everybody's out and they're safe. They don't go back to the houses until the tornado, the code is clear. Here's what's kinda interesting about the code break. It can last 10 minutes, it can be 2 hours. We don't know. What we try to do is gauge what the weather's doing and then let folks go. But we've had times here where they're on watch for a couple hours. We wanna make sure that everybody's safe. So Code Black, we had one yesterday. How y'all felt about it? You said you didn't know what to do. All right, so this is the first thing we don't do. We don't pick up our phone and call 911 because your phone may be a detonator for the bomb. So we have communication quickly, and then we get away and stay put. Don't go nowhere near the bomb. Yesterday we had a couple patients that just walked by, they didn't know. But staff, y'all did a great job of getting everybody away and inside the houses. Why is that important? Because you want to be protected. If there's a bomb, you want to have something, a barrier there for you. So when there is a Code Black, we want to get away as much as possible. We want to hide, do not use your cell phones. Now, I already called the sheriff's department. They dispatched me to communications, so but that happened all before the drill. Because somebody's gonna call and say, oh, they got a bomb in Progressive. So we normally call them and let them know. This is something that Joint Commission has changed. We're not, me and Jesse are not supposed to tell you when we having these drills. We'll fight that because of our patient population, but by law, we're not supposed to tell. So I know some of you are asking, when we're gonna have this drill? Can't tell you, can't tell you. Because if a real life situation happens, we don't know when it's gonna happen. So, any other questions about Black? Keon?
So, it was right over here by
yes.
the road, so we're okay staying in RT.
Get away.
Like staying over
Get
there.
away. Get away and get a barrier in front of you. So, just try to get away. This day and age, they're gonna call a bomb squad here to assess that. Even, they do it at the schools all the time. It could be a piece of paper. If they think it's a bomb, they come. Yes, ma'am.
So I know like yesterday, me and Nick were in the therapy center. Is it like with Code Black, where, you know how you said with the phones, try not to use your phones because it may set off the bomb or whatever? Is that like the same thing with like opening the doors like at the therapy center? You see what I'm saying? Like, if you open the door, it could somewhat trigger?
It could.
Okay.
It could. One thing that I would suggest is once you're in your spot,
Yeah.
stay.
Okay, that's what we did.
Yeah, because that's a good question. We don't know.
Okay.
We don't know. Y'all, I can tell y'all now, the assessment of bomb threats in the last 5 years are very enhanced. The sheriff department, before they get here, they know if something's there. Because they have technology to do it. Now they're flying drones and all kind of stuff. But wherever you are, stay put. Yes, ma'am.
So what happens if we have like for instance, during that Cicely, like she can't move as much, so like she was very like snappy with it, like y'all telling me to do this, da 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 da, and I'm just like,
So that's gonna happen. That's gonna happen. We want to try to direct them and get them in a safe spot. With a bomb, it's a panic, and you're more likely to get that patient and have more time in compliance with them. When we move on to Code Silver, which is the active shooter, you may not wait for that patient. You tried, but you may not wait. But if there's like so, if there's an active shooter, a Code Silver, I want you all to think about this. Where are you gonna go? I want you all thinking about that. Like, where am I gonna go? I will tell you this. A lot of you all may think that the safest spot for you to be is in your vehicle. If you do that, you are sitting down. You should hide in a building somewhere. I can tell you now, I have 4 spots. I'm not going to tell you where my spots are, but I have 4 spots. because I want to make sure that I'm safe. So here's another piece too. I don't know if Jesse talked about this, but if you leave this campus, your supervisor have to know you're leaving campus. Because if there's a true emergency here, we're looking for you. So if Andre didn't tell us he's leaving for lunch, there's an active shooter, I'm going in the Andre office looking for him, and the man sitting in the Andre office. I thought he was in his office. He had sideline. So, but think about this, seriously. Think about where, if there's an active shooter, where can I go to be safe? You need to have some thought about that. We hope that it never happens, but if it does happen, we're gonna drill this, and the active shooter drill is gonna be way more active than bound. It's gonna be a lot of chatter. It's important that you have your walkie-talkie on, because I'm gonna give you a good example. If you're in a session, me and Jess are meeting with one of you privately, and we don't have our walkie-talkie on, and the active shooter is coming up the stairs, none of us know. If they cut the phone lines, walkie-talkies are still available. So make sure that you have your walkie-talkie on. Anything I missed? Eric?
I'd just like to add.
Yes, ma'am. Yes, ma'am.
No, I'm definitely gonna be trying to find me some places to hide.
Yes, ma'am.
Walking the campus and figuring out where I
Yes,
go.
ma'am. Yes, ma'am. So, since you say that, I know that everybody in here knows every area on campus, right? We're gonna assume that you do, right? So if you don't, get with us, we'll give you a map so you know where you are. Why is that important? If a patient grabs you and brings you in house 10, and you call for help, where are you gonna call for help at? Because you don't know where you are. So I'm gonna give you a map. So you know if I'm in house 10, I can say, hey, code, whatever code you call to house 10, because you probably won't remember. But we need to know where you are. We had a code that happened 2 weeks ago, and nobody said the location of the code. It was just a code. So if you call a code, have the code call location and say it twice. Y'all probably noticed that yesterday we actually had it 4 times. Code black and such, code black and such, then Megan, code black and such, and then I think somebody else did it after you. But we need to do it twice. Last thing about the walkie-talkies, if you're calling for someone, I would encourage you to call twice. Dana Andre, because sometimes the first time you don't get it. Any questions about codes, walkie-talkies? All right, yes, sir.
I think you just hold it for a second before you start talking.
Yeah, press the button and hold. Yeah. I will tell y'all this, we're gonna be doing walkie-talkie checks. If you haven't been in one yet, just know it's coming. We're gonna call your name. Everybody can hear. We calling for you. Brandy, come in. Brandy. Brandy don't answer. So you get my example. And it may be me, Jess, or it could be somebody else we task that to. But we want to make sure that you all are safe. It would be a crying shame for something to happen to you at this facility, and your family said, well, my family member such and such happened, and the first thing that happens when I'm in court, and I read that incident report, and I say, employee turned their walkie-talkie off and didn't have it. No form of communication. You all probably noticed with EMS and the police department, especially the fire department, they don't go anywhere without their walkie-talkie, and they don't go anywhere without each other. So keep your line of communication open at all times. Any other questions for me? Amanda is dying to get up here. All right, thank y'all.
Wait, Dan.
Yes.
I have a question.
Yes, ma'am.
So like us dietitians, we only have 2, so what about the rest of the 5 people?
Two
So-
what?
So walkie-talkie, so you say everybody gotta have a walkie-talkie, but in reality, we don't.
Yeah,
because-
so y'all have an area. We have, for example, nursing has an area that you listen to your walkie-talkie. I'm glad you mentioned that, because everybody, your music should not override your communication device. So, yes.
bathroom, freezer, cooler.
Take one with you.
How?
Y'all have two in there, right?
Have two.
Y'all have two, take one with you. So I will say this too. The walk-in cooler, the walk-in freezer, you won't have communication in there. There's a barrier in there that you don't have communication. So if you go in the walk-in freezer, just know y'all know y'all cell phones don't work in there. But just be mindful, take one with you. All right, Miss Amanda, go for it.
You really went over all the stuff I wanted to say for Code Blue. I literally went for
It needs to follow you.
Oh, okay.
It works.
I just wanna remind y'all about some infection control stuff. I know Andre does a great job with the hand hygiene, wash your hands frequently. If they're visibly soiled, soap and water. If they're not visibly soiled, you can use the alcohol-based sanitizers. PPE, gloves, if you think something's got body fluids on it, blood, etc. For example, like if somebody's cleaning a diabetic room, they'll wanna use gloves, cause there's stuff in there. Don't share personal or patient care items, utensils, cups, razors, vapes, phones, makeup, etc. Clean and disinfect shared equipment and high-touch surfaces. I know in nursing, it's like 2 people to a phone, so we're gonna wanna wipe those down daily. I know other people might sit at your desk. Therapists, I know y'all like y'all's office, but like us, other people might come in the evening and eat at our desk or something, so we wipe those down all the time. A big problem we have with the patients, not so much staff, y'all. When you cough and sneeze in your elbow, we're not coughing and sneezing in our hands, cause then we're gonna touch surfaces. Report symptoms promptly. If you got a fever, cough, vomiting, make sure you talk to your supervisors and get advice on what y'all need to do. Any questions about infection control? Alright, the next thing I wanna talk about is seizures and what to do. It will be brief, so if y'all do have any questions, y'all are more than welcome to ask. I'm gonna go over briefly the different types of seizures, because especially if you're not medical, people don't know there's different types. Just in general, if you see somebody having a seizure or you think they're having a seizure, you wanna keep them safe. If they're sitting in the chair and they're shaking, they might need to be moved to the floor. We don't want them to fall, we don't want them to hit their head. Once it's determined they're safe, they're breathing, call a code, nursing will come. But one of the biggest things is time. The time it starts. That's how it's determined if they need to go to the ER, is how long they have the seizure. And somebody needs to stay with them until nursing gets there. Sorry, I'm on the line. The different types of seizures. First, you have partial seizures. What it looks like is a person is awake and aware. Twitching, tingling, and vision changes. It can be emotional or sensory symptoms. I'm gonna do this often, I'm gonna use my own daughter. She gets super emotional, and like, she's 10, she will cry, and she'll just be like, I don't know why. And we know that's something that is like one of her auras. And when they're like this, you just wanna stay with them, speak to them calmly and reassure them, make sure they can't hurt themselves, and ask them to sit down if they're standing. The next type is focal impaired awareness seizures. They're staring, lip smacking, or hand rubbing, confused or unresponsive. They might be wandering around. And how we help people with this type of seizure is you want to gently guide them away from danger, have them sit if possible, but do not restrain them. Speak calmly with them. Stay with them until the awareness returns. And once they're more aware, you're gonna explain to them what happened, what you saw, and just kind of bring them back to reality. The next is focal to bilateral tonic-clonic seizures. That's when they start as focal and then it goes into a regular seizure. Absent seizures, where they just look like they're staring. If they're in group, they could just be sitting and looking like they're staring, but they're not blinking, they're not moving. They could be smacking their lips. They will have no memory of the event. And how we help them, they don't even really need a code, to be honest. Once they come back aware, just maybe call for a nurse. There's no emergency action needed for this particular type. They just need some gentle reorienting when they come back aware. The next is tonic seizures. It's sudden muscle stiffening. They often fall backwards. So if sometimes you can't, there's nothing that we can help like to catch them. We just have to assess them after and make sure they're not injured. They're brief, they last a few seconds. We just wanna protect their head and clear the surroundings, turn them on their side if possible. The next are drop seizures. They are sudden loss of muscle tone. Their head may drop. It's a high injury risk because they're so sudden. We wanna check for injuries, help them sit or lie down. Colonic seizures are the rhythmic jerking. That's what we're used to seeing when we think of seizures. Consciousness may be impaired. These people, you wanna protect them from injury, do not restrain, don't put anything near their mouths, time the seizures, and put them in the side position. Myoclonic seizures are sudden, brief muscle jerks, often mistaken for clumsiness. They might be writing and drop a pen. So it's not like full body. And they're usually awake and aware. No immediate action is needed. We just need to document the frequency and just make sure to prevent injuries. The next is the grand mal seizures. They will have the stiffening and the jerking, loss of consciousness, and a possibility to become incontinent or bite their tongue. This is very important. These, we wanna ease them to the ground, turn them on their side and protect their head. If they have something tight on, we wanna loosen their clothes, like if they have a jacket or something zipped up, we need to unzip it and time the seizure. The only time people really need to go to the hospital is if they're injured during seizure activity or if it lasts longer than 5 minutes. And that's, I know particularly we have a patient, Megan, she had some kind of back-to-back, but she came out of them in between. So we wouldn't count that whole time, it would be the individual seizures. Unknown onset seizures. Sometimes people have seizures and don't know they have seizures. Those are always gonna go to the ER to be evaluated. So the only time when they need like EMS called is if the seizures are lasting over 5 minutes or you have multiple back-to-back and they can't come out of it on their own. That's it. Any questions about the seizure?
Can you touch on the importance of not diagnosing that patient during that seizure and forming opinions during that seizure activity?
Yeah.
And the dangers of doing that.
And because there is a condition that's called pseudo seizures, which means they don't have epilepsy, but they do have seizures. Their body is acting like a seizure. So if you see somebody having this activity, you don't know, don't diagnose, do the same protocols, treat them the same as anybody else. We can't make assumptions. Even as nurses, that's the doctor's job to diagnose. We just wanna make sure we keep our patients safe and their dignity intact. Especially in this big group room, when they call it, especially code blues, nursing's gonna be coming. Make sure there's a clear path to the patient so we can quickly assess the situation and either get the patient out of that setting or get the other patients out of that setting. Just to protect the patient, cause they're gonna be embarrassed, especially if they have all the staff come in right then. Did I answer your question? Okay. Let's go now.
Well,